Okay, this is Dr. Purcell, and I'd like to review a few of the items from the exam. This is exam one to begin some of the development of Think Like a Nurse for you. This first question is one that was somewhat frequently missed, but it's an important thing to think about. So the patient is receiving his third intravenous dose of a penicillin drug. Right there, that tells you he's on a penicillin drug. High possibility of allergy to penicillin drugs, right? Third dose. So now he's had two exposures and now he's on his third. He calls the nurse to report he is feeling anxious and having trouble breathing. What will the nurse do first? So this is a question you're going to have to learn to answer very well. You're going to have questions that say, what is the priority? What will you do first? And you need to use priority setting frameworks. In this case, we think about ABCs: airway, breathing, and circulation. Airway comes first, breathing second, circulation is third. This patient's having trouble breathing and he's having anxiety, which goes along with difficulty breathing. What will you do first? Well, what do you suppose is causing his trouble breathing? What is the most common type of reaction to penicillin if somebody is allergic? Why do we learn about penicillin allergies? That is because the most common reaction to, or the most life-threatening reaction to penicillin is an anaphylactic reaction in which your airway shuts down. And without immediate intervention, the patient could die. So what is the nurse going to do first? You have four options, four things that the nurse will probably do, all four of them, but which one will come first? And the answer is to stop the antibiotic infusion. That is because you have to stop the cause of the person's difficulty breathing. You don't want them to have any more antibiotic. You stop that infusion immediately before you do anything else, before you do anything. And then next, you're going to take their vital signs, meaning you need to know, what is the respiratory rate? How are they doing? Do we need even more intervention? Does stopping it help? So at this point, if stopping the infusion does not help the difficulty breathing and the vital signs indicate that, for instance, the SpO2 is dropping, the respiratory rate is going up or it's dropping because of the difficulty breathing, you now need intervention. You'll probably call a rapid response so that you can get providers there immediately to then prescribe interventions like epinephrine. But the first thing you have to do is stop the infusion. The next one I wanted to talk to you about is, on this version, is number 49. So let's see if we go to that one. Here we go. There's another one about Think Like a Nurse and priorities. A patient's admitted with a fever of 102.8 degrees Fahrenheit. The origin is unknown. The assessment reveals cloudy, foul-smelling urine that is dark amber in color. The nurse will prioritize and complete these orders in what sequence? Let's talk about your question here, the STEM, and what you know. This patient has a very high fever. 102.8 is considered pretty high. We don't know the cause yet. We'll do chest x-ray to rule out pneumonia. We will do blood cultures to check for microbes in the blood. We will do a urine culture to check for microbes in the urine. However, the urine appears to be a very likely culprit at this point. It definitely, if it's cloudy and foul smelling and dark amber, those are all signs of a urinary infection. Do we know if it's in the kidneys? Do we know if it's in the blood? Not yet. But we know the patient is very sick because of this temperature. And now you have orders. Now, the way that you're seeing the screen is in the correct order. So let's talk about this. A lot of people wanted to give acetaminophen first. They said, oh, we got to get that fever down. honestly, the fever is high, but it's a result of a problem. The fever is not what's going to cause demise or kill the patient. It's the infectious process, which is, the way you know that they have a serious infectious process that is life-threatening is the fever. The fever is telling you that. So the very first thing you need are some antibiotics, but you have orders for blood and urine cultures. And you know that if you give antibiotics first and then get cultures, you're going to you're going to throw off the results of the cultures. They won't be true because the blood and urine has already been exposed to a treatment. So the very first thing you do, and this is in Lilly in several places, is the very first thing is get those cultures. And you want to do them quickly. You want to get them done so that you can get that antibiotic on board and start treating whatever is causing the fever. So the first thing is you get your cultures. The second thing is you start the life-saving treatment. Now, this isn't like giving somebody epinephrine, which is going to work immediately for somebody in anaphylaxis, for instance. The antibiotics have to take a while. They're going to need several doses before the amount of microbes in the body is diminished significantly enough to bring that patient back to a state of health. So you've got to get those antibiotics started. Usually the rule of thumb is within 1 hour. We like 30 minutes, but within an hour of the patient presenting with this type of fever and suspicion for a systemic infection. So you've got your blood cultures and your urine cultures done. You've started your antibiotic. And what's next? Let's go ahead for the patient's comfort. We're going to give that acetaminophen. And then we're going to start with our vital signs every 4 hours because we already know the temperature on this patient. We already know they are very sick. And we already know that any delay in getting the antibiotics started is going to make the patient sicker. So we go right to, if you have to choose out of these 4, which one's the last one, it's going to be your vital signs every 4 hours. And probably it's going to be 4 hours from now before you take the next set of vital signs because you have some already with this temperature. So that is the way that you think like a nurse when you have this type of scenario. The next question was another one I wanted to review with you. Now, most of you got this dosage calculation question right. For those of you who did not get it correct, and it is a partial credit question. If you only missed one of the boxes, you got, let's see, the total was 2 points. So it does the math for me. I don't have to go through and do all the math. But each part of that is worth a certain percentage of points. So if you missed all 3, you get 0. If you get all 3 right, you get 2 points. But what most people missed, if they missed points, is how much each dose contains in units, this center part. So everyone pretty much got the very top right. The patient will receive the antibiotic every 8 hours because it's 3 equally divided doses in a day. So that's every 8 hours. And pretty much everybody got right the 25 milliliters of drug. What you got wrong was each dose contains, and it needs to say 500,000 units. Don't worry if you didn't put a comma. I went through everybody's response and gave you credit. Even if you didn't put the comma, you still got credit. It's better mathematically. You should have a comma there, but you didn't get it counted wrong if you just did the 5 and then the 5 zeros. That's fine. We know that you're saying 500,000 units. However, if you put 0.5, that's incorrect because that reads each dose contains 0.5 units. There's no million here. So it does not read 0.5 million units. It reads 5/10 of a unit if you put 0.5. So that would be incorrect. It's details, and the details matter. when you're giving medications to patients. So take your time and read it and make sure that you are putting in the correct number. And then there was this question, which I can only imagine now, looking back and having reviewed all of your learning materials, that you spent quite a bit of time on here trying to figure out which one goes where. In the end, it was the decision of your course instructors that we give everybody credit on this question and nobody missed any points. Because this is specific, this actually is in your ATI, medication administration, your dosage calculation. No, it was your medication administration module and under your parenteral medications, where it says, and this is pretty much the rule of thumb, in a subcutaneous injection, we really give no more than 1.5 mLs. Deltoid, my rule of thumb is, and what I was taught was no more than 1 milliliter, but ATI said up to 2. And ventral gluteal and pretty much all IM injections is no more than 3 milliliters. Now, because so many people missed this question when I was reviewing statistics, I went back and I looked at your Lilly textbook, which didn't really specify this. I looked at your Turner textbook, which does go into this, and they had different measurements. And then your ATI had something different. So because of those, this was very specific, and it was different between two of your learning resources. We decided this question didn't fairly assess your knowledge. So don't worry, nobody got this question wrong.